Today's patient is a 20-year-old male who has no previous injuries or medical history and is not currently taking any medications. He comes in today with complaining of low back pain. So, how did this injury happen?
I was lifting at the gym and failed at a 1-rep max squat 2 days ago. As I was trying to stand up, my back rounded forward and I had to drop the weight.
Okay, and how would you describe your pain?
Sharp pain in my lower back. I sometimes feel numbness and tingling that travels down the front of my leg.
Okay, and does it hurt on both sides or just one side of your back?
It hurts mostly on my right side.
Does it hurt all the time or just during specific times during the day?
Worse in the mornings. If I sit or stand for a really long time, it starts to hurt and I have to move around to make it stop.
So on a scale of 0 to 10, how would you rate your pain both in the morning and during the day?
In the mornings, it's like an 8. During the day, it's like a 6 or a 7.
Okay. So the first thing I'm going to look at is going to be your posture. So I'll have you just stand right here. And I'm just going to be looking at your spine and your shoulders and seeing how everything is aligned. And it looks like everything is lined up pretty good. You have a pretty normal spine curve. So the next thing that we're going to do is we're going to test your sensation. So I'll have you lay on your back right here. And then I'm going to roll your shorts up just a little bit so I can feel your skin. We're going to be assessing 3 different dermatomes here. The first one's going to be L3 on your left side. How does that feel?
Feels fine. That feels fine as well.
Alright, I'm going to move into L4 on your left side.
That feels fine.
And on your right side.
There's a little bit of tingling there.
Okay, and is that where you normally get your tingling and numbness?
Yes.
Okay. And last one, we're going to go into L5.
That feels fine.
And on the right side.
That feels fine as well.
Okay, great. So next we're going to assess your range of motion. So I'll have you stand up for me. And we're going to be testing both flexion and extension. But first I'll have to line up my goniometer. So if you could just put your arms out front. Finding the center of your iliac crest for my fulcrum. And then bisecting the ASIS and PSIS with my stationary arm to find your neutral angle, which is about 10 degrees. So then I'm going to have you bend forward and try and touch your toes. Just go as far as you can for me. Alright, is that all you got?
Yes.
Okay. So it looks like you have about 20 degrees of flexion. So our normal range is about 60, so we have a little bit less flexion than we'd like. And then go ahead and put your arms back out front so I can line up again for extension. Alright. And now I want you to put your hands on your lower back for me. And lean back as far as you can. Again, we started with a 10-degree neutral angle and ended with about 25 degrees of extension, which is within our normal limits, so that's perfect. The next thing we're going to do is going to be testing our muscle strength. So I'll have you lay on your back here with your knees bent. So I'm going to support your feet and I want you to put your hands by your side. We're going to be sitting up like you're doing a normal sit-up. Testing our rectus abdominis and our external and internal obliques. And how did that feel?
That hurt.
That hurt? Okay.
Yes.
So then we're going to flip over and do extension. So I want you to lay on your stomach now. And for this one, since you had a little bit more range of motion, we're going to go to a grade 4 manual muscle test. So I'll have you interlace your fingers behind your head. And I'm going to stabilize your thighs here, and I want you to extend up as far as you can. Good, and back down. Great. All right, so the next thing that we're going to move into is going to be our special test. So our first one, I'll have you stand right here for me. This one is called centralization and peripheralization, which is just fancy words for flexion and extension. So the first one, I'm going to have you bend down towards your toes, and we're going to go 5 times down. Good. 4 and 5. And how did that feel?
That hurt.
Okay, so now we're going to go into extension. So I want you to support your lower back, and we're going to go back lean back as far as you can and then back up. 5 times. 2, 3, 4, and 5. And how did that one feel?
It hurt a little bit on the first one, but not the rest.
Okay, great. So our next special test is going to be the Valsalva maneuver. So I'll have you sit on the edge of the bed right here. And for this one, I'm going to have you blow into your fists and kind of bear down, really tighten all of your core area right here. So just holding for a second and relax. And how did that one feel?
That hurt. I had a little bit of tingling down my leg.
Okay, great. So our next special test, I'm going to have you lay on your stomach. And this one, you're going to have your hands by your shoulders. And I want you to push up as far as you can go. All right, is that as far as you can push up?
Yes.
Okay, and did you have any pain with that?
Yes.
Okay, all right. And relax those arms. And so our next special test, I want you to lock out your knees. And I'm going to lift your feet up 30 centimeters up off the ground, or off the table. And how does that one feel?
Feels fine.
Okay, awesome. So now I'm going to do our palpations. So I'm going to lift your shirt up just a little bit. And to begin, I'm going to start by finding your PSIS, which is your posterior superior iliac spine. So I'm going to start by finding your iliac crest and then working my way down until I find the 2 nodules here that are pretty prominent. And do you feel any pain with those right here?
No.
Okay, great. So then I'm going to go into the middle and just a little bit down and find your S1 spinous process right here. And how does that one feel?
Feels fine.
Okay, and then moving just a little bit up, I'm now touching your L5 spinous process. And how does that one feel?
Hurts a little bit.
Okay, and I'm going to move one more up here, and I'm now on your L4 spinous process. And how does that one feel?
That one hurts.
That one hurts?
Yes.
Okay. So next I'm going to test your muscles, and we're going to test the erector spinae, which were the ones that we tested in the manual muscle test earlier. And I'm just going to find those iliac crests and go in towards the spine, just about an inch off of those transverse processes, and I'm going to have you extend up. Good, and I can feel those muscles contracting right here. They feel pretty even bilaterally, and how do those feel when I'm touching them right here?
It feels fine.
Okay, great. So we're going to move into the last part of the evaluation. I'm just going to have you do a couple squats for me. So I'll have you put your feet shoulder width apart and your hands out in front and just squat how you normally would when you're at the gym. Okay? And let me see one more. All right, so go ahead and have a seat. Based on today's evaluation, I have concluded that you have a herniated disc between L4 and L5. Just to verify this diagnosis, we're going to have you go in for MRIs to see what stage of herniation you are and to make sure that the herniated disc is there. Do you have any questions for me?
I do not.
All right, great. Thanks for coming in.